for what you said about being arrested. I saw that. I saw you were flanked.
Yeah.
You
Yeah.
were arrested
Yes,
at
I
the
saw it
door.
too.
Yeah.
And I just wanted to let you know you are a hero, at least in Stockbridge, Georgia. I looked at that in amazement to see that you were standing up for what was right. Yes. And thank you so much also for giving us like you gave us so much, a buffet of things, to say that, yes, we're doing things patient to patient, you know, or student to student, but we also could do a little more and impact the greater good community, the community district to district. So thank you for that, and to also tell us that while we're ministering to others with their mental health, to also pour back into ours as well so that we can help others. And thank you again. This is a wonderful, and I'm not just saying it because I'm moderating, but this was a wonderful presentation. And we're going to open the floor now for any questions. Does anyone have any questions, comments? Yes, David. If you'll just, we have a microphone.
I think my voice is loud enough.
We want to report you.
Oh, here it is.
Okay, thank you. Thank you, Representative Tar Heel. I also graduated from there, so go Tar Heels.
Yes.
Thank you for this wonderful presentation, and you were singing to the choir, you know, when you talk about healthcare workers being involved with policy. I really appreciate that as a person because, one, I look at structural issues. When I got to grad school, I wanted to study stigma among SGM populations, LGBTQ people. And as I was going through that, I realized that it's not going to be the SSRI. It's not going to help. These are structural issues. And they continue to be interconnected, right? And you're not going to fix these structural issues with medication. Never. We are constantly trying to medicate poverty. We are constantly trying to medicate structural issues.
Right.
And I challenge my fellow colleagues, my nurses and all of this, say, only less than 15% of Americans vote in mayoral elections. Could you imagine if nurses could affect the outcome of mayoral election in this country? 50%, 45% of mayors in this country. How would we be able to influence and affect policies that influence health outcome? Because social determinants of health is 80% of health outcome. Your mayor decide whether you get a street light, whether you get your streets paved. So when we are doing that discharge teaching and saying go for a walk, go for a run, did you talk to your mayor to ensure that they have a park to walk?
That's right.
Is it safe to go out for a walk? Do they have, if I was a rural interprofessional fellow, I lived in rural North Carolina for 6 weeks. These places didn't have a grocery store. And obesity is on the rise. Then circling back, it is the structural issues, right? It's no longer medication. There's not a limited thing that you, quote unquote, as a clinician can do in that office. So one of the things I'm asking you, this is a long way of getting to this, but one of the things I'm asking is that how do we really encourage clinicians, right, to take these things head on? There was a study that was done in New York that they helped patients while in the waiting room register to vote. Because we found out that 83% of people, eligible voters who don't vote, number one reason, registration to vote. So how do we really tap into the powers that nurses have? Number one, the most trusted profession for 20 years plus. When are we going to spend our public capital, public goodwill, and how will we spend it?
I love it. I love it. I love it. You know, I've thought a lot about how when individuals like yourselves are in your jobs working, and I work in the clinic too and in the hospital, so, you know, there's this overlap related to scope of practice. And if anything, civic engagement, if anywhere, would lay with the social worker. Deep somewhere, once trauma or an issue has happened, then the family is involved, or they're trying to figure out X, Y, and Z. And at that point, there's so much crisis there, there's so much happening. We need those soft bedside moments We need those general clinic moments. And sometimes it comes from something saying like, oh wow, I really got to get out of here today. I have to go and vote. Even if you voted yesterday, if it's the early voting week, you know, you have 2 weeks of early voting in certain places, every day, that's what you're saying at your 4 o'clock appointment. Or maybe it means you have on your calendar how many weeks until the voter registration deadline. And you say within your own practice, all right, let's see if we can get about 10 people registered to vote this election. And that doesn't mean that you have to sit with them and go through the application, but it can be you sharing other stories. You know, saying when I registered to vote, you know, I had just, you know, left from this office. If the voter registrar is right up the street, you can actually do it online. Starting to avail people of those resources. Separately, I will share, there are organizations that help fund elections, political action committees, known as PACs. They can be related to anything. So there are nursing PACs, where a group of nurses get together and they say, we all only have $50 extra, but we're going to put it in monthly, and then we're going to determine which candidates we want to support, and we're going to put that money towards helping them get volunteers, helping them figure out what their robocall system looks like, things like that. Lastly, I was so excited when one PAC shared with me that by being endorsed by them, I got a therapist. That they were going to pay for a therapist for me for the rest of the election cycle. Now, as I got deeper into that, I realized the way that it worked was that therapists were offering their services to that PAC for free on the spaces where they had open in their calendar. So I could, just like a patient for them, go into their availability portal and I could see where I could fit in. And I could get a quick you know, pep speech before having to go before the body, or be having to go and do this press conference, or after I've just come from knocking doors and people have literally chased me out of their community because of the color of my skin. Or my volunteers call me and say, hey, this crazy thing happened. We don't feel right now. Like, where are you? Can you come and get us? All of these things. How can you be a part of that? You can start literally this week. We have elections in every state on a cycle, but then sometimes we have special elections. Someone passes away, someone resigns. That's how I got my seat. Someone was so sick of it that she resigned. Her kids were in college, she was over it. And the special election happened within 6 weeks. And so you want to be ready, even if you're not going to run, to support those people who are running. And then as soon as they get in, you're the subject matter expert that they've trusted all along. There's a lot of ways. Thank you for asking.
Thank you so much for your motivational speech. So my research is on health disparities, you know, social determinants of health as it relates to pregnant women and the maternal mortality and preterm birth. So, you know, what sparked me was that you're a doula, and the research shows that if women had that kind of support, that support during pregnancy is so important. So the question came up for me while you were speaking, how can we get doulas, you know, as part of what's available to women during pregnancy? I know you probably heard about the Olympic gold medalist who just died, you know, and it was like, wow, how could that have happened? You know, so I would just like to hear what your thoughts about that.
Absolutely. Right now I'm working on a piece of legislation that would require state Medicaid to cover doulas for anyone on Medicaid for $700. And the way that it would break down is the doula can do 2 pregnancy services at $50, the birth is $500, and then 2 postpartum visits for $50 each. And at each of those touch points, they of course have to report that, and then there is a time frame before they're paid, but that there is a pathway to breaking down financially how much doulas can and should be paid. Now in other states like Rhode Island, they have it at $1,400 Other states, Louisiana just passed one, so there are opportunities to get doulas paid for with your state Medicaid dollars. Please advocate to your legislators for that. Secondly, these pilot programs. You can approach a hospital system with really high C-section rates and talk to them about creating this doula pilot program, where maybe you have a state training table, like we have Healthy Mothers, Healthy Babies in Georgia, and they are training a pipeline of doulas. Those doulas then are certified, and so they can then come and do, beginning probably volunteer hours in the clinic or at the hospital or in labor and delivery. And then that can kind of snowball into a physical program for them. Lastly, I will share TRICARE, military insurance, and two insurance companies in Georgia have had their own doula pilot programs. So when you have both, the hospital system ready to go, the insurance companies ready to go, you can kind of build it to the state level, and that's where we're going right now. Follow up.
So another question, you mentioned that I'm from Florida, so the resources for Medicaid are very limited. How can I advocate on the legislative level to get that doula program or
You would be shocked. You ready? Florida just passed a doula pilot program. Yep. Look into it. They just passed it. Yep. That's been my talking point for the past year. I'm like, our neighbor Florida has done it. Yep.
We have another question back here in the back. Please, before you say your question, would you please tell everyone your name and the state where you're from, please?
Yeah.
My name is Enyo Jata and I'm from Oregon. I have two thoughts just based on the maternal mortality and having doulas. I know a lot of other countries use doulas, or they have practices where a lot of women are there supporting the birth. My mom was a midwife for a long time and did home births, so I saw a lot of people supporting women as they were going through their delivery. So my thought is it would be good to look at some of these other countries that aren't necessarily first world countries to see what they're doing and see and use that as leverage. Like, these countries aren't first world countries and they're succeeding and they're using this practice. We should be doing this as well, and it should be covered because that is part of the birthing process, right? So that's just the thought. The second thought I had, and this is kind of for the group, is in terms of expanding Medicaid, when we don't do these expansions, it also costs money, right? Because people on the Capitol are saying it costs money, but my question is, how much money does it cost to not do it, right? Because so many people go to the ER, or they can't even get in to see us. Maybe they want to come see us, but we're told, schedulers are telling them they can't see us. The schedulers aren't asking if we want to see them.
There you go.
They're not asking if we'll fit them in. They're saying there's nothing on that person's schedule, right? And it's not their fault. That's what they were told to do. Even if we tell them not to do that, for 30 providers, they can't remember everything for every provider. That's what we're told, okay?
Yeah.
But I guess my question would be looking at the cost of not providing this expansion to the states versus providing it.
Absolutely, yeah. We have, within the elected body, we have elected positions within it, and so we have, unfortunately, the terminology is based on slavery times, but we have the whip, who is the person who is, going to get members to vote for the bills and to see where they are. They're going to vote yes or no. And so our whip has compiled a lot of information about the cost savings as it relates to Medicaid expansion for preventative care. And unfortunately, we've also been hit at the same time with this tobacco settlement in our state. Ultimately, surprise, Georgia had a lot of tobacco. And over the years, companies, medical individuals have come out and said, hey, these are the health effects that are happening. And so we were sued, and we've been under receiving money from this tobacco settlement for all these years, and that tobacco settlement is about to run out. And so we've said, hey, at that time we still need to supplement types of preventative care and also still care for that population who's been impacted by this. Because 8 years of a settlement does not change the course of someone's life. And so all of that is kind of wrapped up into one. It's exciting to see, though, that folks are making the intersections and understanding the connections, and I don't feel so alone in talking about these as reproductive justice issues, but really talking about, I think someone was saying earlier, or I remember you were talking about, the mayor having the right to help pave a certain street. Well, depending on what kind of asphalt is used and what kind of community, similar to what happened with George Floyd, because the asphalt in that community was subpar, the heat, that asphalt held more heat, and so his bodily injuries also came from literally the ground being less paid for. And so how, as nurses and practitioners, do we talk about the environmental impacts that come from talking about paving streets? It's not just so that anyone can walk or ride all the time. It's really about health. It's so powerful. It gets so deep.
Thank you for that. Any more questions?
Hi.
Hey, California.
I currently live in Baltimore. My name is Laura.
Okay.
I'm a doctoral student and doctoral fellow in the MFP program. Thanks for coming to talk to us today. My work looks at the intersection of displacement, gender, structural oppression, and how that shapes the suicide outcomes of Latina immigrants in this country, and well, in Baltimore currently. Most of my work has been done in California, a state where Medicaid expansion, and the only state where currently undocumented immigrants can have access to Medicaid, irrespective of their legal status. And so it's interesting because much of my work currently centers community engagement and collective action, because I went into this work really thinking big picture health policy, but immigration is one of the few spaces that has been pretty much stagnant in 30 years. And I think there's, for those of us that are in the immigration space, a lot of moral distress and just exhaustion that election after election, this is an issue that continues to be deferred. And for me as an immigrant in this country and lived experiences myself of migration, I think that it's really hard to, at this point, be engaged in civically engaged, particularly in a community that is disenfranchised and doesn't have voting rights, right? So my question for you, which you might not have an answer, is how do you stay engaged when your experiences and those of your communities are so invisible and excluded and forgotten, truly, as they are among mine? I'm doing that through research, and I think my work is making an impact, but it's hard to see a space in policy when in your area there isn't much change. So,
Absolutely.
thank you.
No, thank you. I will certainly share that I have pushed my colleagues and constituents to call into question the diversity of their staff. For the past 6 years, I have had individuals of my staff who are transgender, who are without papers, who have continued to advocate for systems that oppress them. And that means that I have to operate a little bit differently. You would think that, okay, I get to the Capitol and everyone's like, here, representative, here's your speech, here's whatever, And instead I'm thinking, my team member is about to come in through 5 police officers. They're going to ask her for her ID. How do I stand there in the gap? How do I not get too big and think that, I have to be at this committee hearing? No, I'm going to make sure that my team member is able to be inside with me. My United States Representative, Nikema Williams, who is now here, she took the seat that John Lewis had when he passed away. She also has had undocumented staff. And so, during the legislature, they want, paperwork, they want to understand, how do we push back on those internal systems? So please call into question the diversity of the staff of your elected officials and mean it, more than just lip service, for them to be able to understand lived experience in real time in these legislative chambers. That's the first. The second, I will share my fundraiser, the person who helped me, do call time, raise money, also is not from this country. and intentionally so we had it that way, so that her connections to the work would not get in the way of the work, is all I will share. And so there is room on political staff teams, whether people want to do the work or not, to make sure that it's possible. It is possible for them to do that. And then, of course, on the campaign side, there's that as well. Because the vote, as important as it is, and I do believe that every vote counts. My first election, that runoff, 22,000 people were eligible to vote. 1,000 showed up.
Wow.
So when I got 47.9% of the vote, that was 668 votes. And in order to win in a three-way race, you have to get 50% plus 1. So the spread between 47.9 and 50.1 was 23 votes.
Wow.
For a state legislator's seat that serves 60,000 people, determined by 23 votes. So we had to have a separate election, a runoff. We had to pay for all the polling places, all the voting staff, had to have early voting, all of that again. And so during that time, it was my team members from other countries who were able to rock with me, stick with me, work with me, and understand the work that we were trying to get to. Secondly, I will share, as it relates to political engagement, I'll just share there's so many rooms that I have been cut out of as well, considered to be too activist-y. And I am proud to be an activist elected official, more so than a politician. But it has been folks on my team from other countries who have really just helped to continue to ground me to the work. Unfortunately, Georgia is dealing with massacres of transgender people, and we've experienced a few of those folks being Spanish speaking. And so literally to have a state resolution affirming that person's gender and brought to their ceremony, where maybe even their family members or their people who are not affirming them, but to have that and to have a liaison who speaks that language and to be there, it has mattered deeply. And so I hope that there is some hope, that there are some places where it's not necessarily the communities that don't or should not be there, it's the elected officials who have not made that space and might need to be put on Front Street about it. And you can say Representative Cannon does XYZ, and I'll be there with you.
Very good.
Thank you, Representative Cannon. My name is Jayandra. I am from Indiana. I'm in a PhD program in Indiana. Earlier, you had said that you struggle or that you had imposter syndrome, and that is something that I deeply struggle with to this day. I teach in an undergraduate program and a graduate program in Indiana and out of Notre Dame, Indiana. And when my students call me Professor in Tisdale, I still struggle, like, is that me? They can't be talking about me. So my question to you is, you had given some really good tips about how to ground yourself. I was wondering about your tips into how you deal with imposter syndrome.
Definitely. So I'm excited to share that I'm still on the journey. Every day. There are individuals who have served for so long. They've been a committee chair. They've been in the majority. Now they're in the minority. They have all these connections. They've been a part of national organizations. But they've never come out as a 23-year-old queer person to, all of Georgia. Even with sitting in the jail. I had to think, there's a lot of folks who've not experienced this. What does it mean now that I can walk in this journey? And so there are a number of experiences where I have simply had to write down what feels triggering about people expressing this to me. So right now what I'm working through is when people will walk up to me and say, "Are you Representative Cannon? I saw when you were arrested. I was so angry. I was so mad." And in that moment, I'm sent aback. I might be in the bathroom. I might be finishing a phone call. They have no clue where I was in that world. And I might need to be walking in to testify on something in just a minute. And I just needed a minute to clear my head. And now my head is clouded again. And then I have to pretend like I'm okay, in front of the body. I've had to really work through that as a connecting point for me and others is something that is powerful, is something that it matters how I respond in that time. If I distance myself from that certain person, if I disassociate, it matters. Or if I connect and say, I remember that day too. I also hope that you see that I'm still okay, that I'm moving on beyond that. And how can I come and connect with your community about the fact that people being arrested for the right to vote is still happening. It is not in the 60s. I've had to start really reclaiming that. That's one part of it. The second part of it has been, there is more for me to learn. I don't know everything about maternal mortality. Even though I'm one of the subject matter experts at the Capitol, there are certain parts of it that I don't yet know. And so there is more that I can learn. And so I will lead by saying, a simple phrase like, I feel like I'm standing on a limb right now, but I'm pretty sure, and I enter a fact. And I try to build myself into understanding and asking, is there more about this issue that you know, that you think I should know? Because if someone asks me something that I think that folks should know, it's that in Georgia, hemorrhage and car accidents, same types of rates of maternal mortality. So what does it mean when we focus on the pregnancy-related issues versus the pregnancy-associated issues, and how maybe the hemorrhaging might be something related to the doctors, OBGYNs, nurses, but the car accidents, that might be the car manufacturers. How am I talking to car manufacturers about maternal mortality? There's always more that I can possibly learn. And so dealing with the inside, but also the outside, and just recognizing we all have more to do, has been a part of my work in dealing with imposter syndrome. I hope that your students know that you don't always have to be right, and that you have reflected that within your leadership to them, that you are open to learning. I have definitely seen that as I show myself as being a person more open to learning, some of the folks who originally wanted to be enemies have started to realize that they have more to learn too.
Thank you.
Thank you. I just want to take a moment and share that this past June, Dr. Rashmi Sajani at Smith College did a historical talk about imposter syndrome. It's on YouTube. It's important to watch how it was created. It's based on women being allowed to ride bicycles when bicycles were first designed in the 18-something, and they were really good at it. But at that time, the men couldn't deal with the fact that the women were doing better riding bicycles, and they had still been wearing long dresses, how they dealt with it. She's a historian, and she chose it and said, no longer say you have imposter syndrome. It is a created issue. Own who you are, what you are. Own, as you've said, Representative Cannon, what you don't know, but you are you. You are not an imposter. It's worth watching.
Yes, thank you. Love a resource. And send that to all your legislators too. Just send it right on out.
We all cover.
Hey.
Good morning. Thank you, Representative, for coming this morning. And my name is Edward Oladipo. I'm from New Jersey.
Okay.
So my question, we probably keep it back a little bit to what David said. And this is what I'm thinking, and this is the way I'm seeing it. So nurses are very great because we, come across a lot of people, crossing across lifespan. People go through the ER, some people go through, inpatient care and stuff. So we meet a lot of people in the course of our service to the people. But as you have rightly said this morning, politics is like at every level of our life. And if we don't get involved, how do we influence, how do we put a message out there to change what is going on in the community? This is my thought about it with my experience so far, places I've worked. Most of the employer, right off the bat, they will tell you, you cannot discuss religion and politics here. Your purpose of coming is just clock in, do the job we employ you for, and clock out, and then you get paid.
Yeah, I hear you.
And when you cross those lines, it becomes an issue. You know, you could get right up, you could be invited to a panel, you know, trying to like, you know what, you're doing too much. This is not what we employ you for. And this is what I'm thinking, this is my thought line. What about if we try and find a way that we can use to influence the curriculum at the academic level in school, whereby we know right off the bat that when we came out of school, we are already inclined to influence every individual that we meet. Because if you look at most of the school, if not all of the school curriculum, we are not even exposed to politics.
Yeah.
All what they taught us in school is go out there, provide the care, or probably find a way to be financially independent. So most of the nurses, or probably, if not all, half of the people that came into the profession, if you look at the statistics after the 2008 recession, people left their previous job or their first career coming into nursing to seek financial freedom. They want to pay their mortgage, they want to pay their car notes and stuff like that. So most of them doesn't really have the passion of serving the population that we served. And when they came in, they realized that, wait a minute, this is hard. I can't deal with this patient. You know, I imagine myself, I was in medical, then I moved to psych. Then I asked myself questions. How do people deal with, sometimes when I started working in psych, I look at my shoulder most time when I'm walking in the hallway like, oh, somebody's not going to run up to me from behind. So, and I look at those nurses that have been doing it for years. I ask my question, how do you do this every day? But what we have seen lately, the burnout, the shortage, the politics, the fight in the Capitol, you know, Democrat, Republican, we want this. It's like they are just playing with our brain. They are just picking our brain. You know, you think, oh, if Democrat is in government, they're going to be able to take care of this problem. But no, it's not true. The 4 years we just go like that, another set of people will come in, it's going to be a different story. So my question is this, how do you think we can actually influence academic curriculum whereby nurses will be prepared for post-academic life? So when we get out there, we have an opportunity to be able, even at the micro level, to influence every individual, to encourage them that they need to participate in their community. Minding the fact that most of the states, at the board of nursing level, most of them operate differently. What applies in New Jersey is not what applied in New York. If you're seeking a license in Pennsylvania, you have to go through different requirements and different. So my question to you is, how do you think, if we're going to get involved at the academic level, how do we influence the academic curriculum for nurses, whereby we're going to be prepared for post-academic life?
Absolutely, I love it. First, you have to write the book. So are you committing to being one of those authors? You know, books these days, you can dictate them into your phone, and you can put them in a template in Microsoft Word. You can create a graphic on Canva, and you can upload it to Amazon. You can do it on Kindle. And so I would say first, let's write the book. There might be 4 or 5 people in this room who you are now the curriculum cohort out of here. You know, how do we be biased towards action right now today? Because the things that you have said are so true. That's the first. The second is really that there are pockets of money in each state budget that go towards paying for tuition for certain populations of students. And those populations of students then are required to go through certain other trainings. I'm curious what in your state that looks like. We have a partnership with Mercer right now where we are equipping dental hygienists and dental students with understanding how they can be credible messengers on social determinants of health when they're literally in someone's mouth while you can't really speak and all you can do is listen. So we started there with our dental hygienists. Separately, we're trying to run just a piece of legislation for barbers and estheticians, people who do waxing, people who do your eyebrows, people who do your nails, because they see the bruises or they see what is happening. And so we've written a curriculum as well for those individuals that we didn't get the state law passed yet. We're still working on it. But in the meantime, we have partnerships with all these different barbershops where people can go and take those classes or share experiences. And they're like continuing education credits, units, and it depends on where people are within their licensure, but there are definitely ways to create these smaller pieces. Lastly, I'll share the impact of a nonprofit. I know that there's so many nonprofits, and we talk about this nonprofit industrial complex where it's this vacuum that sucks you in on purpose, and then you expel all your resources, you're burnt out, and you walk out and go towards profit. But while you're in that space of wanting to do nonprofit service, I'm deeply curious if there is a nonprofit that does this. If not, maybe consider. Maybe consider having a few different ones around the country, and then you have your national conference at a state legislature. There's definitely some ways to be, I think, creative about how we do this, and if there are organizations that you want to be on the board of directors of, check and ask them, are they accepting applications for more board members? And tell them what you would bring to their organization. I can think of 2 organizations right now that would really benefit from having someone from an academic perspective focus on, curriculum-based social and emotional support. And I also, invite you to come to Georgia. If you want to come and take a field trip and talk to our local county health department, Fulton County just asked for $13 million in our $28 billion budget to build an observation unit, a mental health observation unit. And we were told by the governor we could have 6. So we ended up at $6.5 million with a negotiation. And after we finish legislative session, the governor has 40 days to sign all the bills. And so day 38, we were looking around. It was within the larger budget package. And he ended up signing the budget, but vetoing our $6.5 million. And told us that we needed to have our local report to our state behavioral health department on what they needed, and that the state should have enough resources to support that. It's a little bit of a around the world way, but we're going to try it. And so sometimes even when it might not be the state table does not decide they're going to include their curriculum, but you have separately through your nonprofit networked with 40 students, and they're bringing it. So maybe just think expansively about how we do this.
Unfortunately, we are out of time, everyone. But Representative Cannon, on behalf of SAMHSA, the Minority Fellowship Program, we thank you for coming today. Thank you for coming to speak to us. Thank you for inspiring us. And thank you for your continual efforts in bringing health parity and health equity and all types of equity to all vulnerable populations in the communities of Georgia and beyond. Thank you.
Thank you for having me. Keep knocking, run for office, do it all, and stay in touch. Thank you.
Thank you.